This is COPD ages 18 through 65, a review of systematic changes by PowerPoint by Jennifer Mounier, BSN. Normal changes that occur in the lungs as we age include the lungs lose their elasticity, the ribs lose their density and flexibility, the alveoli become more rigid. With COPD, it increases these changes at an earlier age, usually starting in the 50s to 60s. COPD changes the function of many other organ systems as well negatively as a person ages. Changes in hematopoietic and cardiovascular function with COPD patients. As we age, we are unable to produce new red blood cells, which leads to anemia. When you add COPD to this, it causes the tissues of the body to receive an inadequate amount of oxygen as well. These patients get their respiratory drive from low oxygen levels. Oxygen saturations should remain between 88 and 92%. COPD causes the right ventricle of the heart to change shape, causing pulmonary hypertension, CHF, and possibly atrial fibrillation. These patients usually die from the cardiac symptoms rather than the respiratory symptoms. Changes that affect the respiratory function with COPD. The epithelial lining of the airways become chronically inflamed and begin to peel away. Mucus secreting cells multiply and expand, increasing the viscosity and production of mucus. Cilia are destroyed, making the ability of the lungs to remove mucus impaired. Smooth muscle in the airways becomes thickened and contract, causing narrower airways. Alveolar sacs lose elasticity and radical traction, causing alveolar collapse. Some of the related assessment findings that we may find in these patients are wheezing, barrel chest, clubbing of the fingers, slight cyanosis or discoloration of the lips, fingers, and lower extremities, low spirometry levels, and low oxygen saturations with high carbon dioxide levels on lab values. Changes that affect the fluid electrolyte and urinary function. There is no direct effect on these symptoms. However, COPD can indirectly affect them. The respiratory system and the renal system work together to maintain a proper blood pH. In COPD, patients retain carbon dioxide, making the blood too acidic, causing the renal system to compensate by reabsorbing more bicarbonate to increase the pH. The coughing that accompanies COPD can cause urinary stress incontinence, which can lead to poor quality of life. Changes affecting the reproductive and endocrine systems. Women usually have a worse prognosis related to the female sex hormones. Estrogen changes the way cigarette smoke is detoxified, causing the toxins to accumulate. Progesterone increases airway inflammation. COPD exacerbation causes the increase in hormone levels such as LH, FSH, CRP, and IGF-1. Increasing hormones combined with medications to treat the disease like corticosteroids can lead to muscle wasting, malnutrition, osteoporosis, cardiovascular disease, type 2 diabetes mellitus, anemia, and depression. Changes affecting the GI and musculoskeletal function. Due to the activity intolerance, COPD patients are focused to live a more sedentary lifestyle, which can cause decreased spinal motion, changes in posture, increased muscle sensitivity, more forward head posture, and a decrease in joint mobility of the thoracic area. There are no changes in the GI function. However, due to the increased effort of breathing, COPD patients can have a decreased appetite and an increased work of eating, making them susceptible to aspiration pneumonia. Modifiable and non-modifiable factors for COPD is usually caused by smoking or prolonged exposure to irritants or environmental pollution. These are modifiable factors that can be changed or avoided to prevent the disease altogether, or it can decrease the rate of progression. AATD, alpha-1 antitrypsin deficiency, is a genetic form of COPD and is not modifiable, but can be slowed if smoking and environmental factors are avoided. Plan of care for these patients. Once a diagnosis is made, education is needed, a support system needs to be established, and a treatment plan needs to be followed, which includes smoking cessation, treatment for depression, exercise routine to maintain activity tolerance, medication education, and the patient needs to know when to seek emergency medical attention. This is the end of the presentation. Thank you and have a nice day.